Hi, I'm Dr. Cory Weissman.
My name is Jean-Philippe Miron, and today I am here to answer questions about
transcranial magnetic stimulation, or TMS.
Transcranial magnetic stimulation, TMS for short, is a non-invasive treatment for depression.
TMS is a treatment that we use for patients with depression who don't respond to standard courses of treatment, so medications or psychotherapy. And it's shown to be effective for these sorts of individuals that have a condition called treatment-resistant depression.
It uses magnetic pulses delivered through a coil to specific areas of the brain involved in mood regulation.
I have a TMS coil to help explain it to you today. So basically, there is metal wrapped around within these coils, and when electricity flows through the coil, it produces a magnetic field that comes out of the coil. That can then lead to electrical changes within the brain as the magnetic field passes through your scalp. And we think that those changes within specific areas of your brain can lead to improvement in symptoms of depression. TMS is a great treatment for individuals that have what's called treatment-resistant depression. So for patients that try one or two forms of antidepressant medications that don't tend to do well with those treatments.
TMS is very different from medication. Medication goes all throughout the body and can cause various side effects like weight gain and sexual dysfunction. When patients have either not been helped by medication or have not been able to tolerate them, TMS therefore becomes a possible option for them. It does have the advantage to have little to no side effects compared to medication.
The primary thing to be aware of is that TMS is a very safe treatment. TMS is done once a day as a treatment over 4 to 6 weeks, so it is a bit of a time investment, but essentially the treatment just lasts 5 to 15 minutes, so it can easily be fit in before or after work per se.
Also, what's important to know about TMS is that you are sitting comfortably in a chair, awake and alert, and you can drive yourself to and back from the clinic. And once the TMS treatment is done, you can resume your activity, go back to work, go back to school.
You can kind of expect a little tapping sensation on your scalp during the actual treatment itself. Some people find it a little bit bothersome, but it shouldn't be too painful. And the nice thing about TMS treatment is as you go for successive treatments, that side effect tends to go away. So your body tends to adjust to the TMS. Because TMS is focal or localized to a specific part of your head or scalp, the side effects tend to be associated with stimulation or treatment at that site of your head. So you can potentially expect to experience a little bit of scalp tenderness or pain at the site of stimulation. These things can often respond to over-the-counter medications. And not everyone experiences these. Some people have complete tolerability or no side effects from the treatment.
TMS is quite effective to treat depression. Studies tell us that about 50 to 60% of patients experience significant improvement. About a third of patients undergoing TMS will even achieve what we call remission when they don't have any symptoms of depression left and feel like their old selves. In patients who have experienced significant improvement from TMS, the good news is also that the effects usually will last for a long time, months, even years. Some patients have described TMS as life-changing after years of struggle with trying different medications. If TMS was helpful for you in the past and that you eventually experience a relapse of depression, we can usually resume TMS and it should work again. Patients should choose UC San Diego Health because we are national leaders in interventional psychiatry. We've been able to attract international talent and we have amongst the best leaders in TMS in the world, meaning that you will always get the most personalized and compassionate care.
We prioritize the appropriate treatment using evidence-based thought and approaches in order to make sure that you're getting the best treatment and the most appropriate treatment for your depression.